Ready.
Namaste and a very good evening to one and all. I am Vaidya Parvati, Special Resident Medical Officer here in Sunetri Ayurveda Ashram. Thank you for joining us in this live Facebook interactive session on Autism Spectrum Disorder organized by Sattva TV in association with Sunetri Ayurveda Ashram and Research Center. Today is April 2nd. From 2008 onwards, April 2nd is observed as World Autism Awareness Day as per the resolution by the General Assembly of United Nations Organization since 2007. This program is intended for making an awareness about autism in the society and to help them to find more practical strategies to face the situation. As we know, the prevalence and incidence of autism spectrum disorder is increasing evidently everywhere in the world. We aim to put a spotlight on the hurdles that the people with autism and their family face every day. This is a growing global health issue which needs serious attention. It is estimated that 1 among 50 children has some features suggestive of autism. This needs serious attention. So, the first step towards it is we should know what exactly autism is, and also we would like to explore what Ayurveda can do in the field of autism. Here in Sunetri Ayurveda Ashram and Research Center, we have a specialty department called as Sun Care, that is Sunethri Care for Autism Research and Education, which is a dedicated department which deals with many autistic kids for many years. Today, we have its director Vaidya M Prasad with us to discuss more about autism, the Ayurvedic understanding and how Ayurveda manages it. And we call upon audience to make use of this opportunity at its best by actively participating in this live interactive session. You may post your opinions in the comments and we will try to include it in this session. Vaidya Prasad is a postgraduate in Ayurveda, and then he developed an Ayurvedic protocol in the management of autism called as SUPRA, that is Sunethri Protocol for Autism. A warm welcome to you, sir.
Namaste, Namaste Vaidya Parvati, and thank you for the very nice introduction.
Sir, let us start with a very basic question. Sir, what is autism according to you?
Yeah, that's a good question because first of all we are supposed to have some basic understanding about what the real issue is. Autism is a sort of neurodevelopmental disorder, and it is common among children, which can be diagnosed very early. Say previously it was thought that it can be diagnosed by the age of 3, and now I think a careful eye, a watchful eye from whichever part it is, autism can be diagnosed as early as maybe 18 months or 24 months of age. And the basic characteristics of autism spectrum disorder is that the child lacks the normal development in certain areas like language and speech, social skills, communication skills, and he shows some sort of a inclination towards repetitive behaviors with very limited interest. That is also very important. So that could be the way in which I can introduce autism in a nutshell.
Sir, how is autism diagnosed and what is the earliest age at which it can be diagnosed?
Yeah, as I mentioned, say when the awareness about autism was very limited, we thought that it may take the time, maybe up to 3 years, to come to a proper diagnosis. But now we have better understanding about the problem. We have better information available in the public domain as well as among the technical groups or the professional groups, including the teachers and the caretakers. So now we can diagnose autism as early as 1.5 years to 2 years of age. And related to the definition what I gave to autism spectrum disorder in my first answer, there can be delay in many of the social characteristics of the child, like social smile. The child does not develop a social smile appropriately, then he's not responding to a call by his name or her name, then showing very minimal interest in getting connected with others around, like even his parents, then getting delayed with many normal development milestones of a social being, like the speech development, language development, and these could be considered as maybe the first warning or red signals to suspect that this child, whether it is a boy or a girl, could be having autism spectrum disorder.
And sir, what is the importance of early diagnosis?
Yeah, that is a very important question, because early intervention is possible. That is the most important aspect about it. If you identify a child as autistic, early intervention is possible. And that early intervention means, actually it has got multiple facets, like giving intensive training in developing all these so-called social skills and behaviors. Along with that, from an Ayurvedic perspective, I would say that to start the right treatment in the right time. So earlier the diagnosis is made, easier the interventions are.
Sir, is it a disability by birth or is it something which is acquired later?
Yeah, actually that is a gray zone, to be very honest with you, because we do not know whether children are born with autism or it is acquired in a later age. Because ideally the problems are related to the behavioral development, socializing skills, language skills and everything. So at least we have to watch a child up to that age of these characteristics start appearing in a normal child. So we may not be able to identify whether a child is born as an autistic child, as an autistic kid or not. But there is no consensus, I should say, that whether it is a congenital issue or an acquired one in the later developmental age or not. Of course, let us hope that more information will be available in the near future.
Okay, there is a question now. Does change in climatic condition affect or provoke the symptoms? How can we address it?
Is it a question
Yes,
from the
yes.
audience? Very
Yeah.
good. See, the climatic condition, I do not know in what depth the question is originally intended. In any case, I think the climatic condition has got a direct influence on the development pattern of every human being. So obviously in the children in that particular developing age group, climate will have its own influence, no doubt. So sometimes it may be the influence that the child is having during his or her intrauterine life, or sometimes it may be the climatic influences that the carrying mother could have gone through then in the early infancy. So all these things could be influential, but I think what I'm giving is a very peripheral answer, because we need more information, more data to make a strong comment on that question.
Okay, sir. Sir, many things are told these days about the gut flora.
Yes.
So, is it something relevant with autism spectrum disorder?
Yeah, definitely. Actually, it is very interesting. See, there was a time in the medical history where every disease, whatever it is, forget about autism, forget about the name of the disease, every disease was some way or the other connected to the status of digestion, or what we call as some sort of a gastric root for every disease. Ayurveda, as an Ayurvedic person, I should say that Ayurveda strongly proposes that every disease has got its root in a principle called Agni in Ayurveda. So interestingly, in the earlier days, this concept was actually neglected, or even that was abandoned, and it was named as gastricism or something like that. It became some sort of a cult at that time. But interestingly, the time has changed. Now, maybe you name a disease and there will be some connection for that disease with the status of the gut flora. That is where we are. And autism spectrum disorder does not make an exception in this regard.
Okay, sir.
Lots of researches are going on world around about how serious or how close this connection really is. That means the status of the gut microbiome and the presentation of the autism spectrum disorder. So definitely there is a connection. Definitely there is a not a very peripheral connection, very close connection. And recently there is a concept called gut brain axis, which is something like a two-way trafficking system in which the gut is influencing the brain and the brain is influencing the gut. So that is the status, and this gut brain's axis is basically defined and determined by the status of the gut flora. So that is how closely this concept is becoming relevant these days.
Okay.
This is
okay,
very
sir.
important.
Okay, sir. There is another question. What preventive measures or precautions can be taken during the marriage life or pregnancy period to avoid autism in children?
It is a tough question to answer, because fortunately, I should say, till date, when a new family is set up, husband and wife, marriage, everything is on track, and we expect that the progeny will be normal. We never get amazed when a normal child is born. Why this child was born as normal, isn't it? Only when a child is born with some sort of a problem, some sort of an abnormality or speciality, then only we look for the reasons. We backtrack and try to get some sort of an answer for this issue. So till date, majority of the children are born as normal, neurotypical kids. So as of now, I think if I give some sort of an answer, specific answer to such a question, I'm afraid I'll be creating some sort of a panic in the audience. So I will be giving some sort of a very peripheral answer to that question, and at that question will be, during the pregnancy and even prior to the pregnancy, before conception, keep a reasonably good physical and mental health. So that's a very general answer, I know, but it tells everything, I should say, because general health physically means you should not be somebody who is on some sort of a medicine every day for some reason or the other.
Okay.
Especially indiscriminate use of antibiotics, very strong analgesics, and many other things. Over the counter consumption of strong chemical medications. All these things are creating a lot of problem these days, especially among the city dwellers. So if you can live without medicines, with proper food, fresh air, good quality water, and a reasonably good health of mind, mental status, emotional stability, I think there is no need to worry about the offspring. Obviously, he or she will be a normal neurotypical child. There is no reason to worry about it.
Okay,
So
sir.
that is what I can say right at this point.
Okay, sir. Sir, what is the importance of diet in ASD?
Yeah, that is what we were discussing about, because now maybe by what explanation or what logic it is, we were living in some sort of a global village. I use the term were because of this present pandemic situation. Now it has become a split world, actually, not a global village. So with the advent of this global village concept, what we missed or what we lost halfway is the local traditions of healthcare, local traditions of dietetics, local traditions of foodstuffs, including the stuff which we use and the way in which we cook. So all these things were lost halfway through our race of the so-called civilization or development, which is quite natural. We cannot move backward, which is this is quite expected one. But interestingly, or I should say unfortunately, what happened is we lost these sort of traditions, and these traditions were important because when it is connected with our previous answer, these traditions were contributing heavily to define our gut flora. That should not be overlooked. So I acquire my gut flora not just by my own actions, but I have some sort of an inheritance. I might have inherited my gut flora over a maybe 5 or 6 generations backward. So when you change your diet, when you change your food pattern, your style of cooking, your recipes, all of a sudden abruptly you are putting yourself in trouble, and you are also putting the next generation in trouble. So when these ideas are put in the context of autism spectrum disorder, we should understand that that is going to be very crucial, very decisive as far as any sort of a management of autism spectrum disorder is concerned. So that is the importance of diet in a nutshell.
Okay, sir. So you're working on the care of autistic kids with Ayurveda. Ayurveda is an ancient science.
Yes.
And how can Ayurveda address this new health issues like autism?
Yeah, that is a very interesting question, and it's a very common question also, because you see autism spectrum disorder is a new clinical entity, maybe less than 100 years or maybe 50 years old, and Ayurveda is a system which dates back to maybe 2000 BC or something like that. So how can you say that you have a strategy in Ayurveda to deal with or address a problem, a new problem like autism spectrum disorder? For that, I should say something about Ayurveda first. We should understand two things. Number one, Ayurveda is a theory-based medicine. That is very important. It is a theory-based medicine. Number two, Ayurveda is a learning medicine by itself. It is they are closely connected. by theory based medicine, what I mean is, it is addressing the issue on the strength of some sort of a theoretical or philosophical background or foundation, which enables the system to decipher or to define or to address any sort of health issue at any point of time. It is not a system of medicine which have all the possible diseases of mankind listed in one single treatise, but it has got a theoretical key or a philosophical key which can be used to unlock any new disease. And using that platform, theoretical platform, a philosophical platform, and using that magic key, this system has evolved as some sort of a smart system, a learning system. So its principles can be put into practice using this sort of a smartness to decipher any new clinical challenge that the human race is facing. Autism is one among them, but I think you can forget about autism. Give me another name, we will have an answer. We will have a mechanism. That is what that happened in the case of this COVID-19 pandemic as well. So that is an advantage of Ayurvedic system of medicine, with which it is capable of, potent enough to address any disease entity of any type at any given point of time. I hope I am clear that way.
Yes, sir. And sir, can autism be treated?
Again, it is a question, the answer of which may put up some sort of a controversy. It is quite interesting also. You see, autism spectrum disorder. So it is a disorder. There is some sort of a disorder which is supposed to be put back into order. So it needs some sort of an intervention. You call it as a treatment, as a cure, or whatever it is. There is a disorder which needs to be put back in order. As of now, there is no proven medicine, pharmacological intervention which can be considered as foolproof to manage this problem of autism spectrum disorder as per the norms of the Western medicine. So it is accepted outright, taken for granted, that there is no cure for autism spectrum disorder. But I should say that it is a wrong notion. I should say that, to the best of my understanding, as per the data and information available till date, autism is not curable as per Western medicine. We are working with autism spectrum disorder kids with this problem for the last 19 years, and from that experience I can say with some good level of confidence that if everything is favorable, if there are multiple factors in it which I may be able to explain later as an answer to a different question. If everything is favorable, autism spectrum disorder is curable.
Okay, sir.
That should be the answer from an Ayurvedic Vaidya who is dealing with autism spectrum disorder for the last 19 years.
Okay, sir. Sir, and what does Sunethri do in this field of autism?
Yeah, Sunetri has got a specialty division called Sun Care, that is Sunethri Center for Autism Research and Education, which is working with autism kids. And we have developed a protocol called SUPRA, that is Sunethri Protocol for Autism, which has its own credential of dealing with autism spectrum disorder and kids with ASD effectively. This protocol is already published, and more works are planned to validate it in a more intense manner. Here we are having some sort of a 3-faceted program. Actually, Sunetri protocol is a 3-faceted program: phase 1, phase 2 and phase 3. Phase 1 is about the primary evaluation and the basic counseling to the parents, then making some sort of a environmental changes and dietary modifications along with the primary Ayurvedic medications, which is supposed to last for maybe up to 90 days. Then the child will be upgraded to the second phase of the program, which is a residential program. Like the child will be admitted in our center, in our facility, for a set of classical Ayurvedic treatments, which is basically a personalized one. So there need not be a standard yardstick to measure all the kids. We will be making some sort of a change this way or that way, but basically all the programs will be classical Ayurvedic treatments, which may go up to maybe 3 weeks maximum. And then the child will be switched over to the next phase of the program, which is again a back home program. For that, they need not stay in the hospital facility. And in that third phase, we will be using some special types of medicines again, continuing with the other basic strategies like dietary modifications, basic trainings, environmental modifications and all these things. But the special medicines, especially medicines like processed gold, we call it as Swarnam in Ayurveda, that will be given in a pharmacological dosage form, and that will last for maybe 80 days. So this is one standard module of Supra protocol, but based on the intensity of the issue, we may need to repeat the second and third phases again and again. That is based on multiple factors: the gravity of the issue, the age of the child and the primary response to the program. So that may be repeated, whereas the dietary modifications and other things will be continued all throughout. So this is what we are doing in Sunetri for the management or the care of autistic kids.
Okay, so can you just explain what are the possibilities where you can completely cure autism?
Yeah, that is a good question. We can completely cure autism provided, one, the child is diagnosed as early as possible. Earlier the diagnosis, better the chance. Like see, right now we have children who are diagnosed even at the age of 1.5 years, 18 months, and such children are responding to the treatment very well, amazingly well. So that is provided the first condition, the earliest diagnosis and earliest intervention, number one. Number two, the gravity of the issue. It is a spectrum. So each child, my autism and your autism need not be the same, even though both of us come under the same diagnostic category. So there may be high functional kids, there may be mild to moderate based on the severity, there may be moderate to severe, there may be severe, there may be very severe, like that. So I think up to the range of moderate to severe, these children can be managed effectively. Then number three, there is a consistency in following the program. As long as the parents show some sort of a consistency to continue with the program, the chances of recovery is more. But that we cannot expect all the time. I am talking from my, I am speaking from my own experience, that when a child is diagnosed with ASD, obviously the parents will be in some sort of a devastated mood. They will be looking for all options, so they need not stick on to one protocol all the time. Halfway through they may get some new information about a new program, they may rush to that place quitting whatever they were doing earlier. So that happens. So as long as there is a consistency, I think the chances are better. Then number 4, complying the protocol completely. Comply with the program fully, that is very essential. There also I have seen some sort of a difficulty from some parent groups, or some parents I should say, because there are dietary modifications. The world or the towns or the cities or the even in the villages where we live these days, I think bringing in some sort of a dietary restriction or dietary modification I should say is not that easy. So as long as the child is complying or the parents are complying with the program fully, I think the chances of recovery, full recovery, is very high. So these 4 conditions are there. If they are met with fully, I can say with confidence that it is possible to cure autism.
So there is an interesting question.
Please.
How can a parent involve sibling of autistic child in helping the kid develop or grow without hampering his own mental status?
Yeah, that is very important. That is very important. If the child diagnosed with ASD is having a brother or sister who is neurotypical, normal child, I think the parents can make use of his or her service very effectively, because I think it is somewhat like the child has got another caregiver who can come to the level of the child very easily. The parent may be having some sort of an issue to come down to the child, especially when the shock of the diagnosis is there deep inside, whereas the sibling who is smart enough can work with this affected child very effectively. And in my personal experience, those kids having such siblings are the luckiest one. Those parents are the luckiest ones, because they can make use of this smartness, the enthusiasm, the dedication, the perseverance of this sibling for the recovery of this autistic child. But definitely that should be done with a lot of care, lot of dedication, because the child should not feel neglected, the normal child. Then even otherwise there may be issues of some sort of a sibling rivalry, so that issues should not be coming there. So by repeated reinforcements or methods of that sort, this child, the normal child, should be made responsible, and in such a way that he or she is enjoying that responsibility. So once he start enjoying the responsibility, he is becoming a standby parent to the child. So that works wonders for the total healing process. That is what I have experienced, that is what I have seen so far.
There is one question, I think it is one of the patients. Our son got treated from your institution. He got admitted 15 years old in 2019 with autism problem. Now we are finding some lack of memory after treatment. He forgot something. He was good in memory, but after treatment we saw that he is stuck in his memory. We are asking you to guide us. What should we do, please?
I think that is a very specific case
yeah.
and a specific individual. I think it may not be easy to give an answer offhand. I will have to see who is the patient, what were the treatments done, what is the status of the child right now and what he was earlier. So really sorry that I am not able to answer it offhand. I have to go to the details. Anyway, I would encourage them to send me the details, and I may be able to help them out.
There is another one, like anybody birth premature can cause autism spectrum diseases.
Need not be. I think the chance of other kids and the chance of this special kid is somewhat equal. So it need not be the case all the time. It is creating some sort of an unnecessary panic.
Panic.
Whereas there are some other findings, like when the first child is getting very delayed, or the child is delayed and along with an assisted pregnancy. So chances of congenital anomalies or abnormalities or developmental issues are high in general, and in that list of potential issues, one is autism. That's all. So we cannot make a very strong statement like that.
Another one, is there any chance that if one child has diagnosed with ASD, then the other will also be born with the same condition?
Yeah, some studies show that the chances are high, but that need not be the case. What I would say is Ayurveda may be able to help them. When one child is already diagnosed with autism spectrum disorder and then they plan for their second child, so obviously there is no foolproof evidence for that, but there are some practices in traditional Ayurvedic methodology or method. There are some practices which may be helpful in avoiding this sort of issues manifesting in the next child. So they may be I think Ayurveda may be able to help them that way. But as per the available information, the chances are high for the next child to have autism than a normal pregnancy. Yeah.
Okay, sir. Good evening, sir. What about autism spectrum disorder brings it closer to your heart?
It's a very personal question. I do not know, to be very honest. Maybe I am destined to work with these kids. That is how I was introduced to this field, and I still believe that there is some element of destiny or karma with me to work with these kids, and I have decided to continue with it. That's all.
Again, one of the parent asked, please explain the relation between autism and visual perception issues. Is there any Ayurvedic remedies?
I think I have to be very go to the very basics to answer this question. In one of my previous answers, I mentioned that Ayurveda is a theoretical medicine and Ayurveda is a smart medicine or a learning system. So I should say that when a child is diagnosed with autism and coming for the treatment, or when we make the diagnosis of autism and counsel the parents to start Ayurvedic treatment, deep inside, the way in which the issue is addressed or dissected, I should say, is not as a case of autism, but as an issue of a child having so and so problems. So the diagnosis is very technical. So it is a developmental issue, and Ayurveda has got its own way of understanding what a developmental issue is, whether it is autism or something else. I'm emphasizing on this answer or this point because there are many conditions as per the modern diagnostic criteria which can mimic autism, and there is no standard foolproof objective test, a blood test or a scan to diagnose a child as he or she is autistic. The diagnosis of autism is by and large subjective, is based on parental interview, then observation of the child, then making some sort of an assessment combining both these data. So, there is some element of subjectivity in the diagnosis. It is not purely objective, as if we are doing a diagnosis of a cancer with a scan, with a biopsy or a scan or something like that. So, Ayurveda cannot depend upon the word autism to manage this kid. It has got its own methodology for addressing what mind is, what mental aberration is, what development is, what developmental delay is. So, we are dealing in an Ayurvedic perspective, and it is purely Ayurvedic. Definitely we put the label that this child is autistic, so we are going to manage an autistic child. So, what we will be doing is a standard program for autism. All these are true, but deep inside Ayurveda has got a different way of approaching these issues, and which I should say that more philosophical than scientific in the conventional meaning of the word scientific. So, the issue what we were discussing here can be addressed with Ayurveda. We will be looking at the child with the particular problem in a peculiar manner, and interventional strategy will be decided accordingly. So, it has nothing to do with the name of the disease. So, that is what I can say about that problem what we were discussing about.
Another question. It is said that these kids have some supernatural power. Is it a fact or just a superstition? Please put your light on it.
Okay. Some of these kids diagnosed with autism spectrum disorder, they show some sort of a special skills in certain areas. Sometimes these skills are quite strange and quite amazing as well. Sometimes we may think that this child is quite a prodigious one, but interestingly such skills cannot be utilized positively in a social setting. That is the problem. The skills like remembering dates past and also forecasting the dates in the future, then singing songs without practice, without rehearsal. So, that sort of drawing and maybe many musical skills especially. So, all these things are there, but generally these cannot be used independently by this child in a normal social setting. That is a problem. So, definitely such skills are amazing many a times, whether it is, what is the word used in that question? Supernatural. So, that way you can say that it is supernatural. Anyway, it is extraordinary. I should say that it is an extraordinary skills. Whether it is supernatural or superstitious, I am not a man, I am not in a position to answer, to give that, to use that word. Definitely it is extraordinary, no doubt.
Okay. Another question is, like, what kind of food is suitable for ASD kids?
Yeah, I should use the simplest explanation for that. Try to give homemade food to the best level possible. Try to use the traditional stuffs to the best level possible. Try to cook the food as traditional as possible, and avoid to the best level possible all the junks, sugary, syrupy, market based products. I know how challenging the idea I am putting forward is, but even in normal kids it is very evident that this sort of an eating habit is creating lot of behavioral issues, sometimes with a diagnosis, sometimes without. So, my simple concept is, traditional, in by all means traditional, and simple by all means. Our tissues, our cells, our body is having some sort of a memory, and that memory is about everything. You can call it as maybe a cell memory or a gene memory, whatever technical name you would like to, you can give it, doesn't matter, but it is a fact that such a memory is there. And when you try to act against that memory, to disturb that memory, your system will behave in a quite weird manner, which is unpredictable. So, when you are living in a tropical weather, your parents are from the tropical weather, your forefathers were from the same tropical weather, your gene memory or your cell memory or your bodily memory will be highly or closely connected to that tropical living. Your body will be designed in such a way. So, out of compulsion of maybe your job or your family shifting to a new atmosphere or whatever it is, a person with a tropical gene memory or cell memory is switching over to a new entirely different, maybe a temperate lifestyle in terms of food and everything. Definitely it is going to reflect in your body, in your mind, and every aspect of your existence, and that need not be positive all the time. So, this aspect should be taken care of when you think about food, cooking and diet. I think that is clear.
Sir, can you just sorry, can you just tell something about the diet which you have included in Supra protocol?
In Supra protocol, the basic idea is the same. What I have explained now is the core concept of Supra, and we have included some extra points or extra ideas in our protocol, which is based on observations everywhere. Things have changed a lot over a period of time. Especially change has happened in our foodstuffs, the grains we use, the food we cook, the drinks what we consume every day, and two such things which is proven to be dangerous is one, wheat and wheat products, and two, milk and milk products. I am not putting a blanket blame on wheat. Wheat is supposed to be one of the ideal grain for human consumption, no doubt about it. But unfortunately, I think the wheat what we get these days, consume these days, is entirely different from what we were getting maybe a few decades back. Something has changed, maybe by the intervention of some technology, biotechnology or something like that, to increase the yield or to bring disease resistance or something like that. It has changed the quality of the wheat and wheat products. Similarly, milk has changed a lot. Milk was supposed to be one of the best food that a growing child can have, but that has changed. Milk is no more an ideal food. Lots of health issues are evolving by the consumption of milk as food. There are many explanations for that. So, I have included these two stuffs, that means wheat and wheat products, milk and milk products, as restricted ones in the diet of these kids. Interestingly, these two stuffs can be seen restricted in many new age disorders and diseases, which is not limited to autism spectrum disorder. many other gut related issues, many other allergic responses, many other autoimmune diseases, we can find some sort of a connection with these two stuffs. So, along with the idea of that traditional and simple homemade food, we have included these two stuffs as restrictions, not as the allowed ones. So, that is the basic idea of the diet what we follow in Sunethri protocol.
Thank you, sir. For gut health, apart from GFCF diet, is cumin, coriander and fennel seed water beneficial? Also, is leaky gut, which at times is taken as a cause of autism, treatable?
So, I think there were multiple points in the question. I do not know, I may be able to answer all the questions in a row. First, you were mentioning about GFCF. GFCF stands for gluten free and casein free diet. A GFCF diet stands for gluten free, casein free diet. Gluten is a protein which is present in the grains what we use generally, and the type of protein in wheat is predominantly gluten, and the problems what we discussed, what we explained with wheat and wheat products is basically because of this sort of the presence of this gluten. So, when we restrict wheat, that means we restrict the usage of gluten. Similarly, casein is a protein which is seen in the dairy products, especially milk, and when we avoid this milk and milk products from the diet, we actually restrict the entry of the protein called casein. So, GFCF restriction, gluten free, casein free diet is advised to this kids with autism spectrum disorder in general. Actually there are conflicting ideas about GFCF diet. There are no scientific papers published to associate autism spectrum disorder or its intensity with the consumption of gluten or casein, but as a practitioner I can say with confidence that this gluten and casein is worsening the symptoms in kids with ASD. So, there is definitely need for restricting gluten and casein. What was the other part of the question?
Also, in leaky gut, which at times is taken as a cause of autism, treatable?
Yeah, leaky gut is actually a condition which is a postulate, I should say. When you have got some sort of an inflammation, some sort of a problem, upset in your gut lining, I should say, by some or the other reason, gluten and casein is suspected as the culprits which is causing this sort of an inflammation in the gut lining. The altered microbiome, gut microbiome is suspected as causing this sort of issue. So, leaky gut is an effect, it is not the cause, it is an effect, and when there is leaky gut, there is a possibility that unwanted, dangerous, toxic stuffs may percolate, may penetrate the gut lining to get an entry into the system, and these can cause unwanted irritations. That is how the concept goes, especially the nerve irritations, creating this sort of behavioral issues in the children with ASD. So, that is a concept, that is a postulate. We do not know, it can be true, there is every chance for that idea to be true, because while we restrict the potential reasons including the foodstuffs for this for controlling this gut inflammation, we find remarkable improvement in the behavior pattern of the children. So, leave aside the allegation that there is no scientific evidence, but by experience we can say that there are certain things like this leaky gut which is happening, which definitely need more validation or evidence to conclude. So, that is what I can say.
So next question is this really a neurological issue or some other issue unknown clinically?
Actually, it is again a very difficult question to answer, because researches are going on in that direction, and coming from an Ayurvedic background, I think I am not the right person to answer such a very specific question. Let us expect that more things will come in the near future to conclude whether it is a purely neurological issue or some other elements are there, or it is an immunological issue, like that, because there are many things happening. Psychoneuroimmunology is a branch which is developing, evolving. So, there may be many things which may be happening in the days to come to give a better answer for that. According to Ayurveda, I should say that it is a problem which is directly influencing the Agni, the digestive fire, which is there with every living being, and that is directly influencing the status of cognitive functions. So, that is what is happening in this children with ASD from an Ayurvedic perspective, and because of the faulty Agni, the internal environment of the child, the internal environment, that is how I would like to explain it. Technically we call it as ojas. So, that internal environment is polluted to such an extent that the mind, the mental faculties, the cognitive sum of the child fails to perform however brilliant it is by default, because it is established in a polluted internal environment. So, these three ideas, that means the problem with the Agni, problem with the cognitive aspects including or the mental faculties of the child, and the polluted internal atmosphere. These three are the major terminals where Ayurveda is working upon while we are dealing with a kid of autism spectrum disorder. The other question, I think I am not the right person to answer it.
Okay, sir, thank you. There is another question. How can state of mind of a parent affect the child with autism?
That is a very beautiful question, because say I am not talking on the basis of a study or nothing like that, but in my observation, those parents who take this problem as a challenge in somewhat a fighter's mood, with some sort of a dedication, without panic, getting the maximum information about it and putting their heart and soul to the reversal of the problem, they succeed very easily. Whereas, those parents who get down with fear, anxiety, frustration, panic, I think by some way or other these emotions are getting translated and transferred to the mental makeup of the entire family members, especially the involved child, and that is delaying the entire process of healing. So, definitely there is a connection between the rate of healing as well as the emotional stability of the parents, no doubt about it.
Okay, sir, thank you. It seems autistic children have less long vision. They are enjoying kind of corner vision. What is the reason? My child is pressing eyes with fingers.
Yeah, that need not be a problem with long vision or short vision, or long sightedness or short sightedness. These children are having a different level of perception. There are many concepts behind it. So, the way in which they would like to see an object, the way in which they would like to perceive an image could be a little bit different from what we suppose or we consider as normal. So, they do some sort of a strange patterns of gazing, I mean viewing things, sometimes head down, sometimes pushing their eyeball from the side, sometimes just a corner vision like that. So, it need not be related. Sometimes some children do not entertain the central vision, they may be using the peripheral vision instead. So, they may be having a tendency to look through the sides sometimes like that. So, that is nothing related with the short sightedness or long sightedness, but these all can be considered as sensory issues, and the same thing can be there with the other sense organs like touch or hearing, smell and taste. In those areas also these children may show these sort of abnormal, as we call it, behaviors, like getting upset with maybe very mild noise, or not responding even to a very high noise, which is of course very rare. Similarly, reacting in a very strong manner even to a very simple touch or a pat. So, that sort of things are there. So, it should be considered as sensory issues, and in our experience the treatment brings definite changes in these sort of issues. That is what we have seen.
The next question is, it would be difficult to draw the line between norm and imbalance, specifically when it comes up with psychological health. What may be the specific Ayurveda objective in related with autism which can differentiate between norm and imbalance?
It is a very difficult question, and to be very honest, what we do is we have a tool which is again a very technical one in terms of Ayurveda, called tridoshas. So, these three doshas means three doshas. Dosha is a technical term. So, there are three doshas by name: Vata, Pitta and Kapha. So, when these three doshas are working properly or optimally, a person enjoys health. And when there is a some sort of a departure in one or two together, or all the three together, doshas, from their normal way of delivering actions, the individual is going to have some sort of health issue, sometimes physical, sometimes mental. So, our way of understanding or our way of assessment is how all these three doshas are working. So, the normal way of working of each dosha in a normal person is well defined or well documented. So, making that normal as the x axis, we try to understand what is the status of these three doshas in the person under assessment. Accordingly, we conclude whether it is normal or a departure from the normal, whether it is a severe one or mild one, whether it is a single dosha abnormality or a two dosha abnormality or a three dosha abnormality, whether the reflections are confined to the physical plane or to the mental plane or both together. So, that is the way in which Ayurveda is understanding such a problem. Coming to I think the psychological assessments as per the Western psychology, I think it is sophisticated, and I should say that it is not my cup of tea.
the stress level of parents in case of autistic kids are so high.
Yes.
Do you have any advice for them?
Definitely, definitely I have advice for them. The first and the foremost advice is, don't think that your life is finished with this diagnosis. There is light, there is hope, even if your child is diagnosed with ASD. Take it as a challenge, try to understand your child, make it a point that your child has a problem and that is to be addressed. He is not misbehaving, but he has a real issue inside which can be rectified, and accept the fact that there are areas where we need some sort of a sacrifice or some sort of a dedicated approaches, and try to get the maximum information about the problem from authentic sources, not from the exaggerated reports and everything, and depend upon one authentic helper like a teacher or a social worker or a Vaidya or a psychologist or whoever it is, does not matter, a dependable person from whom you can get the correct information about the status of your child, and stop some sort of a doctor shopping. Stick on to one reliable program all the time. Take proper assessments on a timely basis and understand how your child is progressing. There are some standard tools to evaluate from your own side whether the present strategy which you are following is effective or not. If you feel that the strategy is not effective to your child, discuss it with your therapist or your healer or your Vaidya and take his opinion. If you feel that the present protocol is not fitting, not the right one to your child, don't delay, switch over to another effective protocol even after discussing with your present healer or Vaidya. And find enough time with your family, find enough time to relax, to go for an outing, to watch a movie, to listen to a music, to do yoga, to go for a walk. Don't think that this is the end of the road. There is light on the other end of the tunnel, and there are many support groups like parent support groups, many other professional support groups who can guide you effectively in your journey as a parent of an autistic child. So, be confident, don't feel as lost. So, this is the advice what I can give you from my experience, experiencing how parents were performing with their children in the last 19 years with me.
Okay, sir. The next question is Kapli wheat, the Emma wheat, suitable for our children?
What is that?
Kapli wheat, I think it is an Indian variety.
I do not understand what that word is. In any case, we had a huge number of wheat varieties in India, and interestingly they were serving the purpose of the staple diet of our villages and our towns. There were no issues at all. I think if you can get the wheat produced out of those traditional wheat varieties, definitely you can use. Otherwise, don't go for it. What we get right now, I think, is very high in their gluten content and they can do harm. So, this is what I can say.
Will a child show improvement in his or her autistic behavior, or will a child overcome autistic behavior as child grows up?
There is every possibility, especially in high functioning autistic kids or even very mild cases. the child may enjoy all the advantages of time, no doubt about it. The child may completely come out of the spectrum and start behaving normally. So, the point is you have to get your child evaluated properly, whether it is a high functioning state, whether it is a mild state, whether we can leave the child as such waiting for getting the advantage of the time. But if your assessment or judgment is wrong, then you cannot come back and start everything again. So, the proper assessment, as we told earlier, the earliest possible diagnosis, correct assessment and timely follow up. You may not require any sort of a medication for your child, he or she may come out, provided the condition is of that gravity only.
Sir, in certain kids, we can see regression of behaviors after giving antibiotics. And why is it so?
See, antibiotics are wonderful drugs, life saving drugs. They have done miracles. When we go through the history of medicine, I think the entry of inclusion of antibiotics in the arsenal of a doctor worked wonders, made miracles, saved millions of lives could be. But unfortunately, as the time passed, the picture started changing slowly. Now, there may be many reasons. Now, antibiotics actually they have become one of the biggest crises that we are facing as far as the health is concerned. When we are getting more and more information about how important our gut flora is and how a course of an unwanted or an avoidable course of antibiotic is doing with the status of our gut flora, I think antibiotics are becoming really a nightmare. So, to the best level possible, we should not opt for antibiotics. If it is not a situation where no alternative is working, of course, there may be many such situations, we cannot avoid the use of antibiotics. Otherwise, do not go for it. It is no more an over the counter medication like some toffee or sweet. We misused the strength of antibiotic. We means the public as well as the professionals, and now we are paying the tax for it. Antibiotic resistance has become one of the major crises now, and this gut microbiome is getting spoiled with every course of antibiotic. And we have kids who regress in their behavioral pattern after the use of antibiotics. Interestingly, there are other studies as well. Actually, there are harmful bacteria in the gut of many autistic kids, which makes their behavior actually really bad. So, in such kids, a prolonged course of antibiotic shows improvement in their symptoms, because many of these harmful bacteria are also dying off, but that cannot be considered as a treatment for autism, because you have to stop at one point. So, once you stop this antibiotic course, then the symptoms reappear, and many a times reappear with more intensity, and that return is not working again with another course of antibiotic. So, antibiotics are creating some major issues overall in all health issues, and especially in the case of autistic kids. That is what we are seeing, that is what we are experiencing with these kids.
Okay, sir. When we can stop dietary restrictions of child, does it has any relation with age or reduction of symptoms?
Yeah, I would like to connect it with the age factor, because according to the Ayurvedic understanding, an individual is considered as a child up to the age of 16. There may be 1 or 2 years difference in other systems or other systems understanding, does not matter. When we come or go beyond that limit of child, we are living with a different physical makeup, immunological makeup, cognitive makeup, when everything is changing. So, the changes that is happening at this point of time, when you cover that milestone of childhood, the way in which the internal environment is rearranged, that is very crucial. We were talking about a principle called ojas to represent the internal environment. So, the way in which ojas is manifesting, ojas is topped up every day, is entirely different once you reach that milestone of crossing childhood. So, that could give some advantage. So, maybe after 16 years a child may be taken out of these sort of dietary restrictions, or in other words, putting the dietary restrictions after that period need not necessarily bring the desired outcome what we were experiencing otherwise, maybe at the age of 3 or 4. So, that is what I can say about that withdrawing of the dietary restrictions.
Related to that, if a child is totally normal, then can we stop specific diet?
That is to be actually it is to be tried. I have not done it as of now, because see it may be taking an unwanted risk. So, I have not tried it, but definitely when the child is maybe perfect in terms of every aspect, you may try withdrawing the dietary restrictions, but I think I should admit that I have not tried it.
Sir, what are the chances of regression after coming out of the spectrum?
You mean a return to the spectrum? I think I have to wait more to answer that question. I have seen some mild features resurfacing in children who has come out of the spectrum, but I think that cannot be generalized or taken as a standard observation.
So, can you share few of your experiences?
Yeah, definitely we can. See, what I would say is, it is not an individual case or individual case stories, because I think for confidentiality reasons I cannot disclose everything, but I can share a few experiences. One may be about the diet. I still remember one child who was doing very well with the protocol, coming out of the most of the striking features one after the other, and then started showing the resurfacing or reappearing of these features again and again. So, initially I had no idea what is happening, but on a very close interrogation or history collection, it was disclosed by the parent that the child was grabbing food items which were restricted for that child, which obviously include that gluten and casein and many other stuffs, from other children in the daycare center, which initially even the parent was not knowing. So, generally in the daycare centers or in the play schools or in the special training centers, the caregivers or the teachers or the trainers need not bother about the importance of the diet, and they may not be properly informed also. So, while doing the or giving the training sessions, there is a practice of rewarding the child, and in this rewarding of the child, they may be using rewards like biscuits. So, such things can be counterproductive as far as our protocol is concerned. So, I have experiences both these things, that means the child grabbing food from the other kids and the trainers rewarding the children with the restricted foodstuffs. So, that was actually a very important observation, which actually was an eye opener, and I started instructing the parents afterwards. That means, when you go to the training centers, make sure that the child is not getting the restricted stuffs from the training center, because it is not about that the parent is not giving or the child is not getting these stuffs from home, but it is important that the child is not getting it at all. Again, another challenge, especially regarding the dietary part, is partial fulfillment, partial compliance with the diet. I always used to tell the parents that it is something like keeping a plate or utensil clean. There is no question of 90% clean plate or 90% clean glass. It is clean when it is 100% clean, otherwise it is known as a glass which is not clean or a plate which is not clean. So, the compliance factor as far as the diet is concerned is 100%, not 99, not 98, not 95, it is 100%. Then another interesting concern of the parents regarding the Ayurvedic protocol is regarding the palatability of the medicines. As you know, we use bitter medicines in Ayurveda like Casein or herbal powders or handmade pills, which obviously are bitter because they are all in its natural form. We do not add any sweeteners or film coating, nothing like that. So, they are bitter or a little bit having some bad herbal smells. So, the parents are always concerned whether they can give this to the child, whether the child will accept this. I used to say yes, there are exceptions, no doubt, but by and large, if you give the medicines regularly with some trick, of course some trick, I repeat, initially the child complies with it, child takes the medicine very easily. Maybe the struggle will last only for a week or so, not beyond that. Afterwards, the child will be really comfortable with the medicine and it will not be a burden for the parents. Many parents used to say that even if I forget to give the medicine, the child comes and asks for the medicine. So, these are some basic ideas or experiences that I would like to share in as far as the Ayurvedic intervention and with the diet is concerned.
Okay. Sir, what are the limitations one can face in Ayurvedic line of treatment?
Yeah, number one limitation is this palatability of the medicine. It is a limitation, especially say maybe a couple of generations back, the people, everybody were familiar with bitter medicines from very young age, but that is not the case these days. Every everyone, each child is getting sweet medicines. They are accustomed with the sweet stuffs from the very beginning, from the day one, maybe like a multivitamin syrup or drop or something like that. So basically they have a sweet inclination. So it becomes a tough thing sometimes, but as I told earlier, which can be addressed very easily. There's earlier days all grandmothers were having some tricks to give the medicine to the even to the very small child. Unfortunately, we lost that art of giving medicine to young children, but I think still a smart mother or grandmother can give any sort of a medicine to a child, and that limitation can be easily overcome. Then another limitation is the need for dietary restrictions. Ideally, the child should have the privilege of using all sorts of foods available around. Whether actually it is whether it is a healthy practice or not is another question, but the world has changed. The exposure to different types of food is so huge, and the amount of temptation for tasting new foodstuffs is also very huge. So obviously the child is getting exposed, but we are putting some sort of a restriction. If we look at the history of the parents who has come to Sunetri and the number of dropouts, most of the dropouts happened because of this restriction for the diet, I mean the food. So that is a big limitation, but as of now we do not have any other alternative. Then another limitation or constraint with the Ayurvedic protocol is the need for this hospital stay. So once in a year, 2 to 3 weeks, the child, sometimes with one of the parents, sometimes with both the parents, sometimes even with the sibling, are forced to come maybe from far away distances and stay in the hospital for 2 to 3 weeks, which is a sufficient reason to make their normal routine disrupted. So that is again a constraint. And obviously I think as of now, except in a few of the government establishments, most of the treatments are going on in private establishments. So the economic factor is also there. So these four are the major things what I would like to highlight as constraints or limitations.
Yeah, so one question. When can we incorporate the other therapies with Ayurvedic management?
That is a very interesting question, a very common question from the parent side. Actually, when the child is in Ayurvedic protocol, Ayurvedic treatment, there is no need of any restriction for other programs like maybe speech therapy or occupational therapy or other specialized methods like oral placement therapy or applied behavior analysis. All these things, special education, can be included or added on to the program of Ayurveda. What we generally suggest is try to avoid antibiotic therapy to the best level and try to mix up too many pharmacological preparations simultaneously. Say along with the Ayurvedic medicines, if you start doing some supplements where maybe in the next week itself, both the practitioners may not be able to make out what is happening and with which medicine. So that sort of practices are also to be discouraged. Otherwise, all the training programs can go hand in hand with the Ayurvedic therapies.
I think it is a time to conclude.
Okay.
What message do you have to the parents of these children?
Yeah, first of all, I would like to say a big thank you to all of the parents, other listeners maybe Vaidyas, other professionals who were kind enough to be with us all through this long session. And one message I would like to give is, autism, diagnosis of autism is, I repeat it, diagnosis of autism is not the end of everything. We have life forward, we have days of happiness in front of us, and Ayurveda can help definitely a lot in your child's journey. So, be comfortable, be happy, and try to explore the benefits of Ayurveda to the best. It is actually your right and your privilege. That is what I would like to conclude.
Thank you one and all for joining this session. Hope this was helpful for many indeed. Thank you.
Thank you very much.